like to talk about a few basic shoulder range of motion or flexibility exercises. These are useful for frozen shoulder or if you have shoulder tendonitis. When your symptoms are higher and you have a lot of pain, I would start off with table sliding exercises. You could do this at home, usually if you go beside your dining room table. You could put a piece of towel so you slide better at home. So we're going to do 3 motions in this setting. So the first one is what we call a forward flexion. In standing, that would be equivalent to raising up in front of you. So what I like you to do is if you sit beside the table, make your body kind of parallel. Your arm's going to stay relaxed. You're just going to move your body forward and let your arms slide. So I'll demonstrate here. You're going to go down as far as you can without having too much pain. Hold for a 5-second hold and come on back up. When you come back up, you don't have to go back all the way. Just bring it back a bit so you can relax. And since I'm talking, so my head is turned this way, but I want you to keep your head straight. When you go down, make sure you go down straight like this. Hold for a 5-second hold and come back. Second direction is what we call abduction. In sitting, it means it's sideways. This one is a bit more difficult. So when you're sitting beside the table there, move your chair out away from it a bit so you have some rooms. And I'll show you in this angle here. So if you put your arm this way, you're going to slide down sideways and go out that way. If you want, you can keep your palm kind of facing up a bit with the thumb pointing to the sky. It puts the shoulder in a better position and go that way, okay? So it might be a bit hard on your back, so you can take your other hand and support it on the table or on your thigh and just slide it down. And then hopefully you can get down as far as you can. 5-second hold, come on back. For these exercises, I would do 20 repetitions. Okay? The third one is what we call an external rotation. So it's kind of like a surrender position, right? So in this way, it looks like it's going to turn out that way. But on the table here, I want you to keep your elbow at 90 degrees, okay? And then so we're going to start off sitting beside it again. But if I put it the same plane as my body, as I go down, it kind of becomes behind me. So I want you to keep it bent at 90 degrees and take it up forward about a foot. And then so when you go down here, you could stretch it, okay? So it's kind of going to that position. So that's what we call an external rotation. So the key to these table sliding exercises is that you have to make sure the arm stays really passive and really relaxed, and you just move your body. Because the point is to move them very gently, but not actively lifting them. Okay, so the other option is to use a stick. You could take a broomstick, a golf club, something that helps you to move your shoulder. So the first direction with the forward flexion, I like you to take your thumb, you could wrap it on top of the stick, okay? And I want you to use the other hand and push it up, like that. So from side view, it looks like I'm raising a flag, okay? Hold for a 5-second hold and relax down a bit, okay? We'll do a 5-second hold 20 times. Direction number 2, we will do abduction. If you stand against the wall, you kind of guide you to move your arm there. So basically you're going to do the same thing, thumb holding the end of the stick, push it up sideways, okay? Hold for 5-second hold and bring it back down. This direction, the abduction, likely will be the most difficult direction to go, okay? So with the wall, you could kind of keep your palm there. The problem is because it's difficult, we tend to go, if I show you in this angle, we tend to let it sneak forward going that way. So using the wall will help you keep it more sideways. Number 3 is the external rotation, which is this turning out. So if we use the stick again, keep my thumb there, I want you to spin out, okay? So as I spin out, I'm going to use my good hand to come out forward a bit and push it back in. So the key is, again, if I'm on the wall here, my elbow cannot escape. What people usually do is if you're on the side here, and if I go on the bend, if I go twisting this way, you tend to lift off. So you need to keep it by your side and go that way, okay? So on the wall here, you can put a pillow behind if you like, or use a door frame just so you have some space so you can spin out, okay? That's the external rotation. So for the stick exercises, you could try to do them in lying down as well if you prefer. So pretend this side is my bad side. I could use the stick and I could push it up. and bring it back up again, right? So that's the flexion. The sideway ones, same idea. I could let it go rest on the bed and come up that way and push, okay? And then the external rotation, if we bend it at 90 degrees on your side, rotate your arm, this arm's gonna come up and down at the same time, then we get a good spinning, okay? If the angle is lower here, you might tend to push it off there. So I like to move it up and go down that way. So for internal rotation, in this direction, it would look like our arm needs to spin down, but in real life, we would have difficulty going behind your back, okay? So for the ladies, you might have difficulties doing your bra backwards. And then other events such as putting on jacket, if your arm is to go backwards, you can reach, or reaching for seatbelt, that is hard. So if you have good range, you could just go behind your back and take your other arm, hold onto the wrist, and pull. And I'll pull towards the other side, also up a little bit, okay? So you do 5-second hold 20 times. If you have more difficulties, you could take a strap. I'm gonna loop it over my shoulder here, okay? And I want you to make a wrap. Hold on to it, and if I pull down on this shoulder, the arm will go up. So from this angle, you can see it goes up like that, okay? So I want you to watch out for, if you do this, make sure your back is straight. Try not to go down like that, because you don't want to strain your back, okay? So the other option is to do these exercises using a door frame, just so that your body could go through. So we're going to do forward flexion, which is the first direction that we go straight up. I want you to go to the door frame. Your body is facing that way. You could take one leg forward just so you could transfer your way through, okay? So you could slowly slide up the wall, okay? And if you push your body through the door, you could stretch, try 5-second hold, and relax down again, and stretch it up again. So I would do facing into the door as flexion. The second way is if you stay sideways, this way, then you could go 90 degrees to the wall and you could slide up that way. So again, we're talking about when you slide, make sure your body don't rotate, okay? You want to go through that. So for the external rotation, I want you to keep your elbow at 90 degrees again. If you take your good hand and hold on to it, you're gonna stand beside the door here. I'm gonna disappear in a second. Turn your body to the other side. Then that would be equivalent to turning this, okay? Make sure you turn your whole body with your legs if you can. Don't torque your back, okay? So here we go again. Go from there. That way. So I use this hand to hold it because if we don't, people might let it drag. So after these range of motion exercises, I would like to finish it off with pendulum exercises. It will help you to loosen your joint and lubricate it. So the first one I want you to do is you want to swing forward and backwards. And it should be very gently. I don't want to see this robotic arm, okay? Almost your arm is like a pendulum. It's very relaxed, and you let it swing. And by the way, I like you to hold on to a table or something, just support your back so your back is not very stressed if you do it like that, okay? So you're gonna go forward and backward like a pendulum, very relaxed. Start with a small excursion. When you get better, you can swing forward and backward. The key is to keep it relaxed, okay? You could go about 100 times. It sounds like a lot, but it takes you about maybe a minute or two. And then you could do, I'll show you this angle, so you could go sideways as well. Okay, so kind of doing like a cross, forward, backwards, sideways, and then obviously you could do like a little circle around one way, and then do a circle the other way. And if you focus on letting the arm drop, almost gonna dislocate and separate from the joint, you will feel good.